Is it done, sir? Technical support?
Yes, sir, you can start now.
Okay. So, very good evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once separated vaccinated. So, this is an initiative from Cadila through its innovation to serve the society and humankind. The topic of webinar is dosage reduction strategy in rabies management, the role of novel vaccine. So, dear doctors, the rabies is the world's first novel three anti-rabies vaccine. And with great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated and 100% compliance was recorded and no case of ADRs were registered. So with this, it is my honor to introduce you to the speaker of today's webinar, Dr. Kulbhushan Kumar, who is here with us, is MBBS from Patiala, running his own clinic there in Patiala. And now I would like to invite Dr. Kulbhushan to initiate the talk, and later on, we will have a question and answer session. All the participants can drop their question in the drop box, and after the session, we'll have a presentation on questions and answers. So now I hand over to Dr. Kulbhushan, please.
Thank you. Thank you for giving this opportunity to have a discussion on the very interesting topic of rabies. So without taking much of the time, we will start with the topic. So I am having some slides to show you. So I will show you the slides and then we will talk with these slides. Rabies is basically a public health challenge in India. Globally, 59,000 human deaths annually, highest in the India. India had 20,000 human
Sir,
deaths.
sorry to interrupt. The screen is not shared, sir. Sorry to interrupt you.
Okay. Let me check. Is it available now?
Yes,
Can you see it?
visible. Thank you. Yes, sure. You can start, sir.
So, as I have told you, globally 50,000 human deaths annually reported in India. India had 20,000 human deaths are there because of the rabies. Accordingly, 60% of the rabies deaths in Asia and 35 are globally. 91% deaths in India occurred in rural area. Every 9 minutes, a person dies from rabies. And locally, mainly causes are there local for the treatment. Local wound treatment is there. And active immunization has been given. After then, passive immunization is given. Basically, 5 doses of intramuscular injection are given, and current challenges of PEP are non-compliance are there. Current rabies vaccines are cell culture vaccines are there, and inactive vaccines are below 50 years old technology is there, and it cause inconsistency in potency, stability issues are there, availability, short supplies, and some adverse effects are also there in this. And compliance with the anti-rabies vaccines are compliant who receive the full courses of ARV, that is the scheduled doses of ARV on the recommended dose date. Delayed compliant who completed the scheduled doses of ARV within 60 days but deactivate from the scheduled days. There are some case studies also given where the like 58-year-old female which has been killed by the dog bite. Hospitalized severe in the 16 days but died after 1 day due to LMA. Same in the case of 38-year male has been given dog bite and 3 doses has been given but later on died after the admission in the hospital. And the third last case is there where the 34-year male has been also been bite by the street dog. 3 doses has been given vaccines but expired on the day of second day of admission. The reason of that may be due to lack of administration of rabies, immunoglobulin, or the poor compliance to the vaccines. And there are some articles are also there, compliance to the post-exposure prophylaxis among animal bite patient, a hospital-based and epidemiological study is also given. And it has been shows that the 53% non-compliant to the full courses of ARV that SAR has been occurring. There is a brief research article is also given compliance to the anti-rabies vaccine in the post-exposure prophylaxis. There is a municipal corporation hospital Bangalore shows that in 2,215 animal bite patients, 1 dose of rabies vaccine administered in intramuscular on the day of 0, 3, 4, 7, 14 and 28 SP. And it also measures the concentrate of compliance to the complete courses. The compliance rate for the intramuscular rabies vaccine was 60%. And concentrate for the compliance to complete courses of anti-rabies vaccine. There's a graph has also been shown to majorly concentrate the compliance to complete the ARV with loss of wages, so 47% are there. And evaluation of rabies vaccine basically has been done by in 1885, then 1819, and then 1976. There is some non-compliances are there which lead to the treatment failure from 31 doses to the 5 dose and still on. And as the Kedla Pharma has introduced a novel 3 doses recommend rabies G protein vaccine, first protein supplement vaccine and then preferred by the LP platform technology. First vaccine with 3 doses intramuscular regimen, that is 0, 3 and 7 days. It causes better compliance due to easy flow regimen and less visits and convenience, ready to use, no reconstitution needed. And clinical studies phase 3 shows the safety and immunogenicity of the novel 3 doses recommended nanoparticle rabies G protein vaccine administered as stimulate post exposure immunization, a randomized controlled multicellular phase 3 clinical studies. And these are the regimens given on what basis doses has to be administered. And the study concludes that novel 3 dose was non-inferior to the refer vaccine, lesser adverse effect compared to the refer vaccines. Novel 3 dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccines. So we thank for the Kedla for taking great initiative. Thank you from my side. If any questions are there, we can have the interaction.
So thank you so much, Dr. Kulbhushan. For the informative talk, we truly appreciate your efforts. Last but not least, we would like to inform you that Rabies has won 2 prestigious awards in innovation category like ET India Pharma Award and Golden Globe Tiger Award. So if there is a question, please ask if anybody. So thank you so much, Dr. Kulbhushan, for taking the time. Thank you so much. Thank you. Have a nice time. Thank you, doctors. Thank you, doctors. Thank you, all the doctors. Thank you.